You'll see a recording up on the top left-hand corner. And just to kick off, my name is Maeve Wright. I am training manager with the State Claims Agency. And we're here this morning to go through the process of logging an incident on the National Incident Management System using electronic point of entry, which is EPOE, to which you are rolling out next Tuesday. I would stress, folks, that in relation to this EPOE, we're not reinventing the wheel here. This is just a different step to what you've been used to be doing. All we're doing is taking what you used to populate on a hard copy form, and we're now doing it directly on to the National Incident Management System. You won't need a log on for this stage of it, but you will need a log on for what I'm going to be showing you towards the end of the session, which is populating the incident review screen. And I'm sure Rory and his team have been requesting from you that you populate that form, which is the setup of your log on. Time is running out on that. It actually takes a few working days to get that done. So the quicker you get them back to Rory, the quicker they'll be sent in to us. Now, I should just say that in relation to logging incidents onto the National Incident Management System, you are indemnified by the State Claims Agency, and as part of that indemnity, you are statutorily required to report incidents to us. And really, in theory, folks, that isn't any different to you reporting to your car insurers if you had a knock in your car. So it's really just that. We insure you or we indemnify you. So you need to report incidents to us. And NIMS is the method that we've provided to do that. NIMS, the system, is provided completely and utterly free of charge. There's no cost to yourselves, and all of your support for NIMS, including this training and any other training, is provided free of charge, as is your support through the NIMS help desk here in the State Claims Agency. The session this morning is made up of me firstly taking you through a PowerPoint representation of the populating of the screens. It's on PowerPoint just to avoid any technical issues that we may have with broadband and all the rest of it. Not technical issues to do with the system itself. They are few and far between. And then what I'll be doing at the end of the session for the last few minutes is just jumping on to our training environment and showing you where to go as far as the incident review screens are. I'm just going to turn off my camera for the moment, just because, as I said, I'm trying to keep an eye on, and there are a few other people just joining there, just so that you're not distracted by my head turns or anything like that. And we will kick off. So the first thing that you will be doing, as and from next Tuesday, is you'll be logging on to the system. And Rory and the team, the QRSM team, have arranged that access to NIMS, rather than having any shortcuts on your desktop or anything like that, will be through the Tallaght University Hospital intranet. So that's the first thing you'll do. You'll log on to the intranet, and you'll then click into business tools, and you'll see there that the incident stroke near miss reporting is listed at the bottom of the business tools right-hand column. When you click on that, you will be brought into the NIMS landing page for both incident reporting and incident management, and also for accessing your user guides there and other guides on general support and training. Now, the two main aspects of NIMS are the incident reporting, for which you do not need a logon, but you will need a logon for your incident management. So for accessing those review screens that I'll be showing you, but also if you are going to be going back into an incident and maybe adding attachments to it or anything like that, you will have to have a logon for that. So that's why it is important, folks, to get your user request access forms back to Rory and his team as soon as possible. When you click onto the incident reporting link on the top left of your NIMS landing page, you'll see the first interaction that you will have with the logging of an incident intake. And that's this page here, where you'll see National Incident Management System and the button to add a new incident. And when you click to add a new incident, you will be brought in to this page. So this is screen one of the two that you will be populating. This is what we call a dynamic page. And what I mean by that is it changes depending on how you answer questions. Okay, so all of the questions that you are answering in relation to the incident are listed down on the left-hand side there. And these are the fields where you populate the answers. The vast majority of our fields are pick lists. That's just to ensure the accuracy and the quality of the data. But also questions will come up and questions will not come up depending on how you answer others. And that's what I mean by being a dynamic page. So it may seem to you here that there are quite a lot of fields to populate. That is simply because of how we've answered these questions. So firstly, it's a person-related incident, because what I'm taking you through is the logging of a patient slip, trip or fall. If I were to have chosen a crash, collision or a dangerous occurrence, there would be much fewer fields to populate on this screen. But all of these fields are relevant. You'll see that the vast majority of the questions listed down on the left-hand side have a little red asterisk in front of them, and that means that they're mandatory. And you won't be able to move on to the next page or indeed save this notice of intake until those fields are populated. And I'll explain a little bit more about those as we go on. So the first question that you're asked is, what is basically the classification or the categorization of the incident? And you're asked, did this incident relate to? And the options are person, property, crash, collision, or dangerous occurrence. Now, each of the, every single one of the fields in NIMS have one of these little radio buttons after them. Okay, now you may not be able to make that out on the screen, what's in it, but what's in the radio button is an I for information. And if you click on any of those radio buttons, it'll tell you exactly what we're expecting to be populated in that particular field. So I've given you two examples here, and the two examples are the category of the incident, so that very first question that you answer when inputting an incident. And there are the four options, as I said, and the help button gives an explanation of what each of them are. Now, this is a screen grab, so I've only taken the top two, person and property. So a person is an incident which involved or impacted a person. For example, staff member, a member of the public, a service user, contractor, etc. And there is a note here saying that a person involved in a crash collision should be recorded under the selection crash collision. The same with property, an incident which involved or impacted state or third party property damaged as a result of a crash collision should be recorded under the selection crash collision. In particular, where that relates, our note in relation to a person, folks, we really highlighted that because we have come across some incidents on the system which were logged as crash collisions, but actually they were a person maybe having run into a wall or crashed to the floor. So anything like that should be logged as a person. Rule of thumb really is a crash collision is involving a vehicle. Secondly, then, the example I've given you relates to our summary of the incident. So this is a free text field that you can populate with up to 1,200 characters. And it's basically information around what has happened. So the hint here is it's important that the information you provide is factual based on the actual incident that occurred. If you wish to provide more information, you can attach notes to the incident upon submission, and I'll be talking a little bit more about that a little bit later on. So that just gives you an idea of what we're expecting to be populated in there. The next question then is this related to a previously reported incident? So there will be possibly occasions where you'll be reporting two incidents around the same event. Okay, when that happens, what you will do is you will change the no to yes. And what pops up underneath here then is a field that's looking for the reference number of the previously reported incident. When you choose that, what it will happen here is that pertinent or common information will be populated into the fields like the date and the time, etc. The date then is the next field, and that goes in the, you can manually type it in the format 2 digits for day, 2 for month, or 4 for the year, or you can click on that little calendar icon in the field which will bring you into a representation of the current month that you are in. The time is a pick list. So that is broken down into the 24-hour slot in hourly slots, starting on the hour and finishing a minute before the next hour. I am asked on occasion, can we not include the exact time that the incident occurred? Not in here because it is a pick list, okay? And again, the fact that we have pick lists is for accuracy of reporting, but also to help you when it comes to getting information back out of the system. If you wish, you can include the exact time of the incident in your free text field. Okay, the next field then is your healthcare locations. So you will click into healthcare locations button here and it will bring you into this screen. The top left-hand corner field needs to be populated, okay? It is a required field and it's a free text field where you will input Tallaght. When you start to type in, or when you input Tallaght, the search button will then become active. You can see there that neither the search nor the select button are active. When you type in Tallaght and hit the search button, it will bring back all of the locations under Tallaght. And this is quite an important step, folks, because the location that you choose here will dictate where the incident or the notice of intake goes to be approved. All right, so approval access will be based around locations as well. Over time, when you type Tallaght in here or start to type T-A-L-L-A, the system will know that it's Tallaght, or even if you click in here, you will see that Tallaght will be listed. That's if you're using MS Edge, which is the recommended platform. Also, when you hit the search button, it may seem that the locations that come up and are listed come up in a kind of a random order. They're actually in code order. Each location on our system has a unique code, unique to that specific location. No other location on the system across all of our client base will have that same code. But for yourselves, if you want to put it in alphabetical order, all you have to do is click on the column heading. It will put it into alphabetical order and it may make it easier then for you to find what you're looking for. You can then click in front of it, click select, and when you come back out to our dynamic screen 1, you will then see the Maguire Ward and Tallaght University Hospital are populated in the location fields. Now the next field underneath here is did this happen, and the two options are on-site or off-site. It defaults to on-site as the majority of your incidents will be, but I have been given a couple of examples by your QRSM team where you may be logging as an off-site incident. So firstly, maybe an incident involving an ambulance. So obviously your ambulances will be out on our national road network. We cannot include the whole of the national road network on our location structure. So in a case like that, and I'm not sure how many of you will be logging ambulances, but this is just to give you an example. In that case, in locations, you'll be choosing where the ambulance is based from. You would note it as being an off-site incident. And then in this free text field, which is not mandatory, as you could see, you'd be writing where exactly the incident happened. Another example, I understand that some of your nurses work off-site. So again, you'd be choosing the location that they are based from so that the incident that you are now logging will go back to their line manager for approval. You again will log it as an off-site incident and note where exactly the incident happened. And finally, I understand that you have a mobile X-ray or CT unit out of your radiology department, which is able to move around Tallaght University Hospital. So again, this is an example of where you would use this on-site, off-site. So you would choose radiology from here. So that again is to make sure that this notice of intake goes back to the radiology approvers. You would note it as being, or leave it as being, an on-site incident because it has happened on the TUH campus. But you would then note, for example, if it happened in Maguire Ward, that the incident happened in Maguire Ward. So that's what you'd be typing in there. So they're examples of how to use that on-site, off-site. And again, folks, that's simply to ensure that incidents go back to the relevant people for approval. Moving on down, then the next field that we have is our summary of the incident. What I'm logging here is an example of a patient slip, trip or fall. So again, only pertinent information relating to the incident. So what we've typed in here is the patient pressed the bathroom call bell. On attendance, staff had fallen in the bath, lying flat on their back. There was an obvious laceration to the head and staff called for assistance. The next field is immediate actions taken. This is not a mandatory field. It may not be known to you at the time of logging this what actions were taken, but we do know here. So we're noting that the patient was assessed for injury, GCS and pain. The patient was then assisted back to bed. Their vitals were checked. A pressure bandage was cupped to the wound and the medical team were contacted. Next two fields then relate to who was involved. So because this is a patient, the option we choose here is service user. Other options in there would be member of the public, staff member. And because I've chosen service user, all of the options in then the category of person relate to patient. If I had chosen staff member in there, all of the options here will be relating to staff, so medical, catering, etc. We then move on to the details of the person affected. We have two fields for their name. The first one is their surname and the second one is their first name. Their date of birth is mandatory because again, we're assuming that you will have the file to hand. The gender of the individual, their healthcare record number, and then the lead clinician under whom they are being assessed. The division for yourselves will always be acute hospital. The specialty here, in this case, is older persons, and then we're noting that the incident occurred under surgery, general surgery. You can fill in the please specify box and you'll then click on next to go to the next page. The next page, pretty much all of its fields are mandatory bar the last two. And these all relate to, well, the first one, I should say, relates to the outcome at the time of the incident. And those words are quite important, folks, because at this stage, you are logging simply what is known at the time that the incident occurred. I will be showing you where you will go if any additional information comes to light. So if it happens that this individual, Paul O'Connell, maybe a couple of days later ended up requiring stitches to the wound or whatever, then I'll be showing you where you can go back and you can do it. But at the moment, we are reporting at the time of the incident. And at the time of the incident, the injury or illness required first aid. Okay, so we're noting that. Because of that, did this result in is automatically populated with harm. And also just to mention that what you put in the outcome at the time of the incident will directly feed into how the incident is categorized and the severity of the rating of the incident. Next, we move on to the incident hazard category. So because it's a slip, trip or fall, it's exposure to physical hazards. The other options that you would have in that drop down are clinical care, behavioral hazards, chemical hazards, etc. And then because I've chosen physical hazards, the options that I have in sub-hazard type are all related to physical, and I'm choosing slips, trips or falls. I'm choosing from equipment or furniture, and then I'm asked to specify, and I can type in manually bath. The problem cause, again, this is a pick list. We're selecting unknown. This is one of the few pick lists, I think one of only 2 or 3 in the logging of an incident where you have the option to choose unknown. But the other options in there, because again, we're logging this at the time of the incident, it may take time to find out what the cause was. So the options are what the problem cause was. So the options that you have in there are horseplay, surface contaminant, etc. But we're logging this as unknown for the moment. Then we move down to the injury details. You have the body part injured. You have the list of body parts ranging from top to toe. And we're choosing head excluding brain here. The classification of the injury is general injuries. And under general injuries, we make the selection of cut, laceration, graze, or scratch. And then the last section then relates to who's reporting the incident. So again, one field for the surname, second field for the first name, the category of the person reporting the incident, the date they reported it, and then, excuse me, this local system reference number, folks, this is a historical field that used to be populated with a cross-reference of the local incident reference number. So just to explain that, there was a time when each of the hospitals and each of the healthcare locations around the country would have had big books of incident forms. Some of you may remember them, and they each had their own reference number on those. So the idea here was that you'd have a bit of cross-reference. You'd input here that the reference number was on that hard copy, and then on the hard copy, you'd note the 8-digit number that you got back from the system. What I've been asked to ask of you is that if you're reporting, if and when you're reporting property incidents, if it's hospital property that has asset tag, that you include the asset tag numbers in there. And again, that's just so that Rory and his team can have a bit of cross-referencing there. Finally, on this page, you have witness details. It is not mandatory, as you can see, but it is good practice to get into the habit of even populating this with NA or none, just so the person who's approving it knows that it's not a case that you didn't include the witness information, but that there weren't any. And at this stage, then you can hit the next button. The system brings you in to verify that you have checked the information that's included. You change the no to yes. When you do that, the submit button is now active. You can submit the incident. The system will check that you want to submit. And when you submit, you will get what is currently a 6-digit confirmation number. This is the NIMS notice ID, and it's simply a confirmation to yourself, folks, that the incident has been, that this notice of intake has been saved. I need to be careful with my terminology there because it is not yet an incident. So an incident number has been now put aside for this number, but it is not an incident until it is approved by your managers and approvers. That number is just your assurance that it has been saved somewhere and hasn't just gone into a black hole. Speaking of your approvers, just to give you an idea of what it is that they see, they, as I said, will have a logon, and they will log on to the system and they will go to their incident intake module where they will see this list of intake notices for approval. And these are all of the notices for approval for this particular logon. And there you'll see Paul O'Connell, which we have just entered there now. When they log on to the system, what is being expected of them, they then will click into that particular notice of intake by clicking on that folder module there. When they click into it, this is what they'll see. They'll be brought to this page here saying, have you confirmed all the details are accurate? They haven't as yet, so they will go back through the incident detail page 1 and incident detail page 2. If they're happy, they will then submit it. However, if they're not happy, they have the option to void what is in this list until they go off and they check it. The voiding simply means that it's taking it out of this particular view and gives them the opportunity then to go back off and check in with yourselves or whoever they may need to check with, that the information in that notice of intake is acceptable. If they are happy, they'll come to the approver detail pages. They'll change no to yes. They will populate the approver initials with their own initials, and then they will submit it as an incident. The system will check that they are happy to submit and then give them this 8-digit number once they have submitted. This is now the incident record number assigned to this particular incident. Just to explain this number, it is made up of 8 digits. The first 2 digits will always be the year in which the incident has been created. Okay, so we're obviously in 2023, and the 23 represents that year. And then the 6-digit numbers afterwards are simply a counter, which will go up as our incidents are being added to the system. It is unique to this incident, folks. Should this incident at any stage become a claim in the future, it will then become the claim number associated with that claim, and it will be used on all correspondence between our claims managers in the State Claims Agency and in the daily running and the daily claims management of that particular claim. Should the incident be deleted, and there are occasions where incidents are deleted in the case of duplicates or anything like that, then there's a process that we follow as far as deleting it. It requires a form that's populated by your site liaison person. We need to have a signature on it, and we will then delete it. And that incident number is deleted as well and never used again. We do not reuse or regurgitate those numbers. And you'll see also at this stage, you can attach a file. So just on that, any of the Microsoft Suite file can be attached to an incident. PDFs can be attached. Soft copies, CTs or X-rays can also be attached to a file. Okay, so that's that stage of it. What I now want to show you, I'm going to log on to the system and show you where you will go to a look at your incident review screens. Okay, so we will assume that you now have your logons to the system. I just need to change the view and share. Okay, so now I'm sharing the NIMS. I've logged on here. This is our training environment, folks, so you are not seeing anything that you should not be seeing here. And when you log on to the system initially, you will be brought into our dashboards page. So this is one of the tools that we have provided to our users, to our client base, to get information and to aid getting information back out of the system. So basically running reports. The ability to do that is a whole other training session that we will at some stage, I'm sure, be taking you through, or those of you who would be interested in getting data back out of the system. But it's not for this morning because it is a little bit complex and it takes more time than we have access to this morning. What I am showing you is that you will go up to your app launcher. So the cube made up of those 9 dots is your app launcher, and you're going to go to your incident manager. Okay. Incident manager is the Google of NIMS. It is where you go to find stuff. Okay. And what you're going to be doing here, more often than not, what you will be doing is you'll be coming in here and you'll be going down to all incidents created in the past 7 days. Now, I know that the incident that we just recently created was over 7 days ago. So I'm going to go into the previous month so that we're able to see some of the incidents there. Well, actually, just let me go back and see if the created in the past 7 days is still there. No, it's not. Okay, so created in the previous month. Where is it? Sorry. Created in the, I know that's not bringing up anything, go down, in the previous month. And here are a couple of incidents that have been approved that were on the system. And what you guys will need to do is click into this folder icon. And when you click on that, that's basically the open icon for that particular incident. You're going to go down to your incident review module. And the fields that I have been asked to show you that need to be populated is additional outcome since the incident. And if I click into that, there you'll see the options that you have. This particular incident at the time was logged as injury requiring medical treatment. So I only have the options of it and above it. That's one of the fields. Then obviously, if you're going to be populating that, you would need to include the additional details on the outcome. So for the example that we had of Paul O'Connell, if he required further CTs or stitches, you'd be including that in here. The next pertinent fields are, has open disclosure happened? And the options that you have in here are no or yes. If you're making the choice of no, you need to populate the reason for non-open disclosure field, which is opposite. And then you need to go down to line manager and title and populate the line manager name and title. And that's it, folks, then. That is all that's required of you at this stage. Okay, now before I open up to questions, I'm just going to turn off I'll leave the share up. And I'll stop the recording. Okay, so does anybody have any questions for Rory or myself?